Just a little bit about this device. This device, in comparison to the back three, this is designed to deliver quick analgesic, effect to the patient. The treatment's designed to be, in that 5 minute range. I really, really have been having great success using this for tendon injuries and soft tissue trigger points, that kind of stuff. A lot of times when I'm dealing with chronic stuff, I work at a frequency in the 2 to 5 hertz range, less of a tens type of stimulus. For more acute things, I will use that. I'll work in the 10 to 25 hertz. From there, my patients get more of that, the analgesic effect through the gate theory, that kind of stuff. So here, I had been working with this patient for a couple of weeks, and we had been messing around with different settings, trying to see what was going to give him the most relief. He's a golfer who I was actually treating primarily for a total knee replacement on his right side. Over the course of our rehab, he developed some left patellar tendinitis, let's call it. But it had been bothering him from before the surgery on the right knee. So here I'm working in the shock mode. Finally, after toggling with the settings a little bit, I said, let's just hit it with, the most intense setting that the device has to offer. So this is going to correlate to 100% of their thermal effect with 100% of that high tens. So you guys can see here, these are my parameters. I'm working in that shock mode. I am keeping the ground positioned anteriorly because I really want that current kind of concentrated through the patella tendon as well as the retinacula surrounding the patella. And I'm just working back and forth. Again, this is only going to be a 4 second trigger, right? It's such a high blast of energy. The machine doesn't stay on, right? These machines are all very intuitive, and that's one of the great things I love about them. They are very user-friendly devices. But you can see, I'll just play it again quickly, just working back and forth over that patella tendon. This patient responded really well to this. It's something that we do sometimes pre-session, sometimes in the middle of session. If we were doing an activity, he was saying, Den, my left knee is starting to bother me a little bit. Can we, mix this in? We'd head to the table, do this. It would allow us to continue to, perform the exercises. One of my favorite things about these devices is that it's allowing my patients that are in pain to move pain-free. And, in the healthcare field, right, all of us here, we're believers movement is medicine, right? And we can get these people moving and performing movements that were previously painful for them. It can really have super, super awesome, effects on their emotional and physical health.